I was speaking on organizational factors and their effects on workers' health and safety, and emphasizing in particular the importance of considering those organizational factors separately for men and women. And my explanation, I started by looking at a very recent epidemiological study, a study of populations that found that women had more compensated mental health problems than men. And the way the scientists had set up their study, they said they couldn't explain the differences between men and women on the basis of the working conditions, because they compared professions and they compared industries, and they said men and women in the same industries, women have more mental health problems that are compensated. This is an Australian study. And then I proceeded to share results from one of our studies on mobbing and psychological harassment or psychosocial factors related to psychological harassment, showing that men and women were differentially exposed to something like bullying and harassment as compared to what you would notice if you were just looking at occupation or if you were just looking at industry. And for instance, women who are highly educated are no less exposed to psychological harassment than women who have primary school education. Whereas men with primary school education, they're more likely to be exposed to bullying than if they are managers and if they're at the top of the hierarchy. So my conclusion in relation to that part of the presentation was that really exposures to psychosocial hazards in the workplace, like high demand, low decision latitude, never having enough time to do a good job because work has been so compressed, that this is happening differently for men and women, even within the same professions, even within the same occupations.